In this practice, I've been given a nickname of the professor, and I come by it honestly, I think, because I feel very strongly that patients need to understand, not have things happen to them, but understand why we're doing things, have them understand and agree to what we're doing. And I find myself doing a lot of teaching all day long, every day, across a variety of disorders. I've also found that it's not possible for patients to recall every detail that I tell them, or for their family members who may be interested to participate in these visits where they can hear this firsthand. When I first developed the idea of this website, it was designed specifically for my patients to help them understand what we talk about, not to replace a visit or replace any advice I may have, but to reiterate what they've heard while they've been with me or with the doctors in this office, and to help understand when you're outside of this room, when questions, other comments may come up, and to share with your family members. Your family is your biggest support, and they need to understand just as well as you do what's going on and why, and what you may be going through at the time. What you'll find on this website is a variety of topics addressing all types of swallowing and speech disorders that are very common in patients with head and neck cancer or a history of head and neck cancer. Every patient is unique. This is not designed to diagnose any issue, but to help you understand what you have been diagnosed with or are facing in terms of treatment. It's providing answers, I think, that a lot of patients are afraid to ask the questions. So I ask them for you. And I respond with answers that I hope you find helpful, informative, and should you have questions beyond that, I've provided a venue for contacting us. My patients also understand the door's always open. You might not have a scheduled appointment. You can call, you can ask a question. If it's something urgent, I see you quite quickly, in many cases the same day. It's a part of making you feel comfortable and functional, less a patient and more a person. When you first learn you're going to have a laryngectomy, you can be quite scared, and I understand that entirely. I'm not going through it myself, but helping hundreds of patients through it. My job is to reduce your anxiety and show you how to be the best you following the surgery, which is quite possible. I expect a lot from my patients in terms of their responsibility, but I have a gigantic responsibility that I'm grateful for every day. There's nothing more rewarding than watching a person speak for the first time after a laryngectomy. Seeing the look on their face when they tell you they had meatloaf for dinner the night before, learning to eat and realizing how fantastic it is. I enjoy my work very much so, but I enjoy the transformation my patients experience even more.